Sore throat in children can be prevented and managed by following some simple tips such as practicing good hygiene, which can reduce the spread of germs that cause sore throat. Teach your child to wash their hands frequently with soap and water, especially before eating and after coughing, sneezing, or blowing their nose. Also, teach them to cover their mouth and nose with a tissue or their elbow when coughing or sneezing, and to dispose of the tissue properly. Avoid sharing utensils, cups, or toothbrushes with anyone who has a sore throat or other infection. Boosting the immune system, which can help the body to fight off infections and diseases. Make sure your child gets enough sleep, eats a balanced diet, and stays physically active. Also, make sure your child gets all the recommended vaccinations, which can protect them from some serious illnesses such as measles, mumps, rubella, chickenpox, and diphtheria. Avoiding irritants, which can damage the throat and make it more susceptible to infections. Keep your child away from smoke, pollution, or chemicals, and use a humidifier or vaporizer to moisten the air, especially in dry or cold weather. Also, limit your child's exposure to allergens such as dust, pollen, or pet dander, and use antihistamines or nasal sprays to control allergy symptoms if needed. Sore throat in children is a common and usually harmless condition, but it can sometimes be a sign of a more serious problem that requires medical attention. Sore throat can be caused by viral or bacterial infections, allergies, irritants, injuries, or other conditions, and can cause pain, fever, and difficulty swallowing or breathing. Sore throat can be diagnosed and treated by a doctor who may prescribe pain relievers, antibiotics, or other medications, depending on the cause and severity of the symptoms. Sore throat can also be prevented and managed by practicing good hygiene, boosting the immune system, and avoiding irritants. We hope you found it informative and helpful. Please subscribe to our channel Health 360 for more videos on health topics. If your child has a sore throat, you should take them to see their doctor, especially if they have any of the following signs. 1. High fever above 101 degree F or 38.3 degree C. 2. Trouble breathing or swallowing. 3. Drooling or inability to drink fluids. 4. Rash or joint pain. 5. Stiff neck or headache. 6. Earache or sinus pain, symptoms that last longer than a week or get worse. The doctor will examine your child's throat, ears, and nose and ask about their symptoms and medical history. The doctor may also do some tests such as a throat swab, which involves rubbing a cotton swab over the back of the throat to collect a sample of mucus. The sample is then tested for strep bacteria or other germs. A rapid strep test, which can give results in minutes, but may not be very accurate. A throat culture, which involves sending the throat swab to a laboratory for more detailed analysis. This can take a few days but is more reliable than the rapid strep test. A blood test, which can check for signs of infection, inflammation, or other conditions, such as mononucleosis or allergies. The treatment of sore throat in children depends on the cause and severity of the symptoms. Some general treatments include pain relievers such as acetaminophen or ibuprofen, which can reduce the pain and fever. Do not give aspirin to children under 18 years old, as it can cause a rare but serious condition called Reyes syndrome. Antibiotics, which are prescribed only for bacterial infections, such as strep throat or abscesses. Antibiotics should be taken as directed and for the full course, even if the symptoms improve. Antibiotics can cause side effects such as nausea, diarrhea, or rash, and can also lead to antibiotic resistance, which makes infections harder to treat. Fluids, which can help to keep the throat moist and prevent dehydration. Encourage your child to drink plenty of water, juice, or broth, and avoid caffeinated or carbonated drinks, which can irritate the throat. Rest, which can help the body to fight off the infection and recover faster. Keep your child home from school or daycare until they are fever-free for 24 hours, and limit their physical activity and exposure to others. Home remedies, which can soothe the throat and ease the discomfort. Some examples are gargling with warm salt water, which can reduce the swelling and inflammation in the throat. Dissolve half a teaspoon of salt in a glass of warm water, and have your child gargle and spit out the solution several times a day. Sucking on ice chips, popsicles, or hard candies, which can numb the throat and stimulate saliva production. Avoid giving these to young children, as they can be a choking hazard. Using a humidifier or vaporizer, which can add moisture to the air and prevent the throat from drying out. Clean the device regularly to prevent the growth of bacteria or mold. Eating soft, bland foods, such as soup, yogurt, mashed potatoes, or oatmeal, which can be easier to swallow and digest. Avoid spicy, acidic, or crunchy foods, which can irritate the throat. Sore throat is a general term that describes pain, discomfort, or irritation in the throat. Sore throat is a common problem during childhood and is usually the result of a bacterial or viral infection. Although sore throat usually resolves without complications, It sometimes requires treatment with an antibiotic. Sore throat can be accompanied by other symptoms such as fever, cough, runny nose, sneezing, swollen glands, red or white patches on the tonsils, difficulty swallowing or breathing, loss of appetite, earache, headache, nausea or vomiting. The most common cause of sore throat in children is a viral infection, such as the common cold, the flu, or mononucleosis. Viral infections usually get better on their own within a week and do not need antibiotics. However, some viral infections such as herpes simplex can cause blisters or ulcers in the mouth and throat, which can be very painful and contagious. Another common cause of sore throat in children is a bacterial infection, such as strep throat, which is caused by a specific type of Streptococcus bacteria. Strep throat can cause severe throat pain, fever, swollen glands, and white patches on the tonsils. Strep throat can also lead to complications, such as rheumatic fever, kidney problems, or scarlet fever if left untreated. Strep throat needs to be treated with antibiotics to prevent these complications. Some less common causes of sore throat in children include allergies, which can cause inflammation and irritation in the throat, along with sneezing, runny nose, and itchy eyes. Irritants such as smoke, pollution, or dry air, which can dry out and damage the throat lining. Injuries such as cuts, burns, or foreign objects, which can cause pain and bleeding in the throat. Tonsillitis, which is an infection and inflammation of the tonsils, the two lumps of tissue at the back of the throat. Tonsillitis can cause sore throat, fever, difficulty swallowing, and bad breath. Abscesses, which are collections of pus that form around the tonsils or at the back of the throat. Abscesses can cause severe throat pain, fever, difficulty swallowing, and drooling. Abscesses can be dangerous and need urgent medical attention.